We live in a country teeming with people of all different types of backgrounds and histories. There are no two people that are the same. Like a fingerprint, everybody's needs are different, your health's different, your finances are different. Overall, there is no one size fits all when it comes to anything, especially insurance plans. What I want to talk to you today about is a special type of plan called a chronic special needs plan. A chronic special needs plan, also known as a C-SNP or what we call C-SNP, is for people who have chronic special conditions such as diabetes, heart conditions, kidney problems, sometimes just problems with daily living. These types of plans are unique to these particular individuals because they are verified by their doctor that this is something that would benefit them because of their overall needs. In order to qualify for one of these types of plans, ask your broker or insurance agent to see if it would fit your specific situation. Just because you have one of these types of conditions doesn't mean that the plan is right for you or it's going to fit you better than another plan would. Everybody's situation is different and unique. And just because it has the name chronic and just because it feels special because only certain people can get it and you would qualify doesn't mean it's that good. So what is the difference of one of these plans from a regular Advantage plan to a chronic special needs plan? Ultimately, not a lot of differences, at this point anyway. As time goes on, these insurance companies, what is predicted to be anyway, will be adding in more and more benefits. But as of right now, in some cases, the max out-of-pockets are similar, if not maybe a little higher. Co-pays to see doctors, once again, pretty similar. Hospitalization costs can be very similar. One big benefit you would see from a chronic special needs plan are things like durable medical equipment for your diabetic testing and needs, and those supplies can be at a much lower to zero copay, where you might have a 20% coinsurance on a regular plan. But overall, you're not going to see a huge benefit from plan to plan. Those chronic plans do give you some additional stuff, $50 a month for groceries, some of that kind of stuff that's included in there. But overall, dental, vision, hearing, and everything is going to be pretty similar from one plan to the next. One good thing about C-SNPs, though, is it does allow you an extra election code, which means that you can use that mid-year. If something changes and your doctors don't take your plan anymore, or suddenly you're not getting out of your plan what you need, and you can't wait until annual enrollment, one of these plans can be available for you to take advantage of at any time throughout the year. You start the first of the next month. Election codes are a precious commodity. They are few and far between, and they are a finite resource. We do run out of them, and we can't just switch all the time to whatever we want. But this does give us an extra opportunity to make that change if it fits your situation from year to year and month to month.
Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well.
Once again, just because you qualify for these plans doesn't mean that it's the right plan for you. You want to make sure your doctors are in network first and foremost. You want to make sure it's going to be an easy plan to use. I like to generally talk more about PPOs than HMOs. Sometimes HMOs aren't bad. Sometimes they fit your situation, but you do want to make sure that it fits your situation just right, because sometimes getting into a plan that's going to give you more referrals and pre-authorizations than the plan that you had may not fit you just right. Also, you want to make sure your medications are covered well through the plans. A lot of these plans do have lower costs of medications. A tier 3 drug might be a $5 copay in one plan as opposed to a percentage that would be on a regular plan. So you do see some improvement in some of the medications. Once again, it has to fit your situation just right. And some of the benefits, like I said, are going to be pretty much the same across the board from plan to plan. Something to remember, insurance companies do make a lot more on these plans than they do on a regular plan. They are more inclined to want you to be on these plans. That's why they advertise them. That's why they push them out. Anytime a company is talking about something more, it's generally not because it benefits you more, generally it benefits them a little bit more. So they are having higher subsidies on this plan, and more likely, if you qualify, they'd be very, very happy to get you enrolled into these particular plans. Some brokers do also make higher commission on these plans, so they're more likely to say maybe this is the right plan for you. Make sure they're going through all the details of the plan and that it does actually fit your situation and it's benefiting you more than it's benefiting them. In the end, when deciding what's right for the right person, I still generally will recommend a Medigap supplemental plan over one of these types of plans. You have full access to your doctors. You're not surprised on a copay. That durable medical equipment costs are covered in full. You have complete coverage through Medicare, and you know exactly what your costs are going to be from year to year. Nothing replaces original Medicare when it comes to how good it is. You've paid for this your entire life, and so you want to be able to take advantage of that and not just replace it, throw it away with a plan that's going to replace it with their own copays and systems. But sometimes plans do fit in the right situation. Everybody, like I said, is like a fingerprint, They're like a snowflake. Everybody is unique in their situation. We want to make sure that it fits you just right.
Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link. And you click on that link, what we're going to do is we're going to give you free access to this Medicare Essentials Workshop. And we want you to watch it because we don't want you to make any mistakes.
As I mentioned before, the hospitalization costs and the copays and everything are pretty similar to a regular Advantage plan. So make sure you are protecting yourself if it's available in your state by looking at a copay protection plan. Hospitalization copays that you can go your first few days in the hospital are still pretty significant in cost, so you want to make sure that you don't have a surprise whenever you're calling an ambulance for an emergency if you're getting some unexpected cost that you can't afford. These copay protection plans, like I've talked about in a previous video, which you can see the link down below, will tell you a lot about how much they cost and how much they're going to cover to help you in your situation to avoid unnecessary costs. Your situation's different from the next person down the road, from your brother-in-law, your sister-in-law, person who says you should be on this plan or that plan. In the end, you need to find what's right for you. And situations change all the time. What's right for you today might be different for you next month. This is where the most important advice I give to anyone is making sure the person who is helping you with this is looking out for your best interest, and in the end are going to be helping you and be available to you to make changes as necessary. So knowing what you need is important, sure, but knowing a person you can call who you can trust is the most important thing you can do in making decisions, as everything is constantly changing around us, and we need to know that we can rely on someone who's going to be there for us. I hope this has been helpful to you to understand a little bit more about what a C-SNP is and maybe if it fits your situation or not. For more information, watch these videos down below from Marvin Music and reach out to us if there's any other questions that we can help you with. Thank you.